afternoon to all of you. Myself, Dr. Mitali Lia. I am working as an assistant professor at Ahmedabad Physiotherapy College, Parul University. I am welcoming you all in this beautiful event on behalf of Parul University. Today, I am happy to introduce your resource person, Dr. Jayesh Parmar, who is going to conduct a webinar on basic concept of energy system, energy expenditure, and FIT principle. So he has done his PPT from MS University in 2003. He had taken master degree in the cardiopulmonary disorder from Pune University in 2006, and he scored first rank in the master also. He is currently working as a principal at Faculty of Physiotherapy, Marwadi University. He has also experience of working as a principal at Government Physiotherapy College, Jamnagar. He has exceptional patient service skill and clinical expertise also. In short, he is peak of knowledge for today's webinar. Now, I will request Dr. Jayesh Parmar to share his knowledge with us.
Okay. Thank you very much, madam.
Thank you, sir.
Yes, I would like to thank you, Parul University, Dr. Gaurav Patel, who is a very good friend of mine. And thank you for giving me this opportunity. And within this 1 hour, I will try to give some knowledge which is very important for the understanding of calorie expenditure or energy expenditure. So without wasting much of the time, I would like to start from the beginning, that the current topic, today's topic, is energy system and its expenditure and FITT principles. Now we all are aware that we have mainly 3 energy systems in our body, that is the immediate source of energy, short-term energy system, and long-term energy system. We all are quite aware about that immediate source of energy system will be coming into the picture immediately. When you start doing any work, immediately this ATP phosphocreatine system would be working, and it will provide the ATP to complete our task. If you go beyond after some seconds, then short-term energy system would be working, and later on long-term energy system would be working. So here you can see that when the immediate source of energy system is working, the rate of ATP production is very high, but it will not stay for longer period of time. It will work only for up to certain seconds. And same way, glycolytic system, that is the short-term energy system, again, rate of ATP production is also good, but again, it will not stay for longer period of time. It will stay nearly, you can say, 1 minute or nearly 1.5 minutes. The aerobic system, the rate of ATP production is low, but the sustenance is very much high. So this is the basic concept about energy system. Here you can see clearly that for the sprinting kind of activity, which takes nearly 8 to 10 seconds or nearly 15 seconds, our creatine phosphate system would be providing the energy. And the next one, that is the swimming, in which short-term energy system would be working more. And the last one, that is the marathon runner, after 2 or 3 minutes, the immediate source of energy system, short-term energy system will be working very less, and the aerobic system would be working more. Now, the main thing is that generally we say that now only a short-term energy system is working or only long-term energy system is working. But you can see with this graph that in the beginning, the short-term energy system, immediate source of energy system is dominant. After 30 seconds, short-term energy system would be dominating, and for 3 minutes, the aerobic system would be dominating. So, if 5 minutes also, other system, especially energy system, is still working, but it is not dominating or it is not being exponentially as like the long-term energy system. So, at the exercise, maybe at the end of 3 or 5 minutes, aerobic system would be working more than the short term or immediate source of energy. So this we are quite aware that immediate short term energy and the long term energy. Now we are coming to the next point, that is the energy expenditure. Now we are aware that any activities, it can be categorized as light or medium or heavy kind of activity depending upon the cost of activity or energy expenditure. Most light activity, this is very important. Many times we feel that we have done lot of activity in our day, but all these activities are very light in nature, so energy expenditure would be also less. And we know that heavy work needs energy from both aerobic and the anaerobic system. Now this is very important point, that metabolic equivalent. Slowly we are entering into the energy expenditure system and its main concept. So the full form of MET is metabolic equivalent. Now what is this MET? Now MET is defined as the energy you use when you are resting or sitting still. It means right now when I am sitting still, I don't do, yes, I am speaking something, but if I don't do anything, then my mat would be considered as a one mat. My mat would be considered as a one mat. Now, if I do some activity which is 4 mat, it means you are exerting 4 times the energy than you would if you were sitting still. It means if I am walking, if I am running, and the energy expenditure is 4 times more, then it can be considered as a 4 mat. One mat is very simple. One mat means when you are not doing any activity and when you are sitting still, then it is considered as a one mat. Now, how it is correlating with the other energy expenditure? So we know that we always think about calorie, how much calorie we have consumed and how much calorie we have burned. So that is the main concept of expressing the energy. And this kilocalorie also, or it can be expressed in the oxygen equivalent. It means what? It means that when we utilize 1 liter of oxygen, we are burning 5 kilocalorie. Again, I'm repeating, when we utilize 1 liter of oxygen, we are burning 5 kilocalorie. If we use half of the liter of oxygen, our calorie would be burning, it would be nearly 2.5 kilocalorie. Now, everything we are combining, a mat is defined as the oxygen consumption per kilogram of body weight per minute. It is equal to approximately 3.5 ml per kg per minute. It means that we will see this with example, that how this calculation of mat, and it will be helpful to make us understand about energy expenditure. Let's suppose a 20-year-old girl and her weight is 60 kilogram doing exercise, actually not exercise, but see, when she is in resting state, one mat would be 3.5 ml per kg per minute. Now we know that her weight is 60. So if we put 60 over here, her one mat would be 3.5 into 60. That would be around 210 ml of oxygen. Remember that when she is doing nothing, still she needs some amount of oxygen, and when we convert this oxygen in the mat level, then one mat for that girl would be 210 ml. Now we know that 1 liter of oxygen would be 5 kilocalorie, that we have seen in the last or previous slide. that 1 liter would be 5 kilocalorie. How much oxygen C is utilizing? That is 210 ml. So this is like 1/5 of 1 liter. So same way, C is burning 1 kilocalorie. Why? Because 1/5 of 1 liter, same way 1/5 of 5 kilocalorie would be 1. Conclusively, if we see that for her, when she is in resting state, she is utilizing only 1 kilocalorie per minute. She is in resting state. She is not doing anything. That is our resting metabolic rate. If we see in a different words, resting metabolic rate, or you can say a basal metabolic rate also, the conclusion is that if weight is 60 kilogram, if she is doing nothing, she is simply resting, so she will be utilizing 210 ml of oxygen for the cardiac activity, for digestive activity, for thinking, for breathing. So she will be utilizing 1 kilocalorie per minute. Now, for rest it is 1 mat. Now suppose she is walking. She is walking with moderate level of intensity. So maybe her mat could be 4. It means she is utilizing 4 kilocalorie per minute. We know that 1 mat was 1 kilocalorie for her. 4 mat would be 4 kilocalorie for her. Remember that if weight is changed, this also can be changed. If instead of 60, if weight is 80, then the level of oxygen utilization would be more. It would be 250 ml, nearly 250 ml. So again, the calorie burning would be different. So as per the weight, the mat value will be different and oxygen utilization would be different, and ultimately kilocalorie utilization would be different. But if we stick to our example that 60 kilogram weight is there, and at resting at 1 mat, she is utilizing 210 ml of oxygen, so she is burning 1 kilocalorie. Now she has changed her activity from resting to the walking. So suppose it is 4 mat, so she is consuming 4 kilocalorie per minute. If she is doing fast walking, so maybe 6 mat or nearly 6 mat, so kilocalorie requirement would be also 6. Running, you can say maybe 8 to 9 mat. So her kilocalorie per minute would be 8 to 9 per minute. And the last one is sprinting. It would be more than 10 mat. This activity can be considered as a more than 10 mat. So per minute she is utilizing more than 10 mat and 10 kilocalories. Sorry, not mat is also more than 10, and calorie requirement per minute would be also more than 10. Again, I am repeating that if you are aware about the weight and if you are aware about the activity and the level of mat, you can easily calculate how much calorie is being burned by that person. So this is the table which depicts same thing, that for light work, the calorie requirement would be nearly 2 to 5 kilocalorie, and the mat would be 1.6 to 3.9. And these are the different level of activity. Same way for moderate activity, the calorie requirement would be 5 to 7.5, and for heavy activity, the calorie requirement would be nearly 7.5 to 10. Now, this is again one more classification, that these are the level of activities which we do daily, and these are the requirement of mat. And if you are aware about the weight, easily you can calculate the amount of calorie burned by that patient or maybe by yourself. So the standing light home activities, walking around the house, this will be nearly between 1 to 4 minutes. Climbing a flight of stairs, walking up a hill, run a short distance. So this kind of activity would be nearly between 5 to 9 met. And greater than 10 met, strenuous sports or heavy professional domestic work such as scrubbing floors, lifting or moving heavy furnitures. So this gives you a rough idea that which kind of activity correlates with the different type of mat. When you don't do anything, your mat would be 1. When you increase the intensity of activity, it will be 2 and 3. Again, if you increase, it will be 4, 5, and accordingly your mat level would be also increased. Now we will come to the next point, that is the how this food and calorie is correlating. So generally we consume daily different type of carbohydrate, proteins and fat. These are the main 3 macronutrients which we consume every day in our food items. We will take a simple example that this is a packet of Amul butter, okay, which we all must have consumed it. If you see the energy, see they have clearly mentioned that per 100 gram it is 720 kilocalorie energy is stored. The packet is 500 gram. You can see here the packet is 500 gram, but for 100 gram they have depicted all the energy. This is a routine Amul butter which we consume many a times in our breakfast or in the lunch. Now you can see that if we consume 1/10 part of Amul butter, 1/10 part of Amul butter, okay, it means we are consuming 50 gram of butter. Okay, the packet is 500 gram and we are consuming 1/10 part of this packet of butter. So total gram would be 50 gram. Here for 100 gram it is 722 kilocalorie. So for 50 grams it would be nearly 360 kilocalorie we are consuming. Okay, so if we consume this much kilocalorie by a part of butter, now we know we have consumed 360 kilocalorie by butter. We know the activity level also, that if we do moderate kind of activity, then our energy expenditure would be 5 to 7. Now see, just try to understand that we have consumed 360 kilocalorie by Amul butter, and if to burn that butter, if we do some activity, moderate intensity level of activity, which is nearly 5 to 7 met. Okay, we have understood that how met is calculated with the utilization of oxygen and how met is reflecting the kilocalorie. So if we do 5 to 7 met activity, which is nearly, you can say 5 to 6 or 5 to 7 kilocalorie per minute, it means we are burning 5 to 7 kilocalorie if our activity is moderate. So just imagine that if we do this activity for 60 minutes or 1 hour, so at the end of 1 hour, we are going to burn 360 kilocalorie. If we do mild, moderate intensity activity, if you do mild activity, again, you need to work out more, maybe more than 1 hour to burn this 360 kilocalorie, which we have consumed by the butter. Okay, you can see the fat level also here. The energy from the fat is almost total energy. Total energy is 722 and the energy from fat is 720, which is almost equal to the total energy. So the thing is that we take hardly 5 to 10 minutes to consume, but to burn that same amount of kilocalorie, we need to work very hard. If you do moderate intensity, you have to work maybe nearly 1 hour. If you do intense activity, you have to work maybe 40 to 45 minutes. Same example we take with the Parle-G. I just want you to understand the concept of kilocalorie, how much kilocalorie we are consuming. So here again, for 100 gram, they said that from 100 gram, total amount of kilocalorie would be 450. I have observed most of the food packet items, and for most of the food packets, 100 gram would be nearly 500 kilocalorie. It will be plus or minus 5 to 10%, but most of the food item, it will be for 100 gram, it will be 500 kilocalorie. So same thing is applicable here also, that for 100 gram of biscuit packet, it would give you 450 kilocalorie. But this packet is 70 gram packet. So the total energy for this would be nearly, you can say 300. So if we consume one packet of Parle-G, we will get nearly 300 kilocalorie. And you know that when you consume 300 kilocalorie, how much time you need to work out to burn that kilocalorie. Again, this is a very interesting example because most of us, we consume this kind of chocolates in a routine base. Okay. So if we see this dairy milk, now you see for per 100 gram, energy or kilocalorie provision is 523. So you can consider nearly 500. Again, the fat content would be always more compared to the other food items. So when you consume this 100 gram chocolate, maybe you consume 50 gram of chocolate, and now you know that how much time you should work to burn that kilocalorie. One more example, that we consume bread also, and one slice will give you nearly 110 kilocalorie. This is again one more interesting example. Many of us we are fond of pizzas. Okay, of course, toppings would be different, but if you consume a simple pizza, over and above, the one serving or one part of pizza would be giving you 320 kilocalorie. So we know that if we consume one triangle of pizza, we need to work at least 1 hour. See, I'm just talking about kilocalorie. I have not talked about saturated fat and unsaturated fat. That will also have some consideration in our calorie. So if more amount of fat is there, definitely that will be collected stubbornly, and we need to work more vigorously to burn that collected fat. But just to give you concept that how calorie is consumed by us and how it is being burned by us. This is very interesting statement, that when we burn 7,000 kilocalorie, we are burning 1 kilogram of fat. Okay. It means if you want to lose 1 kilogram of fat by the exercise, you need to burn 7,000 kilocalorie. Once you burn 7,000 kilocalorie, we can think that you must be losing 1 kilogram of fat from the body. Okay, it's a really input and output, how much calorie you are consuming and how much calorie you are burning. Okay, many a times, many of these students, they do fasting. So fasting will be the energy consumption would be less. So definitely, once the energy consumption is less, definitely we are, or the person who is doing fasting is going to lose the weight. But the best thing is that the restriction in diet and the activity, if anyone does both the things simultaneously, that is the calorie reduction and at the same time burning the calorie, that is the best combination, because only starvation or fasting will reduce your calorie intake, but it will not give any kind of training effect. So to get the training effect, ultimately person should do the some exercise also. So we'll come to this example that if you want to reduce 1 kilogram, you can reduce 400 kilocalorie in your daily requirement, and you can burn 300 kilocalorie per day. So ultimately your reduction would be 400 and burning would be 300. Total you are using 700 kilocalorie. You are using 300 and you are reducing 400. So ultimately the cumulative effect would be 700 kilocalorie. So 700 kilocalorie in 10 days, it would be 7,000 kilocalorie. At the 1 month, it would be 3 kilogram. But sometimes 3 kilogram reduction in weight you may not achieve, because do once you reduce calorie intake and when you do the exercise, your basal metabolic rate will be also slightly reduced. Okay, and that is the reason that you may not get reduction in 3 kilogram, but it will be near to that. When you do exercise, definitely the basal metabolic rate will also be maintained, but along with that, reduction of 400 kilocalories also there. That is the kind of, we have restricted ourselves from our daily requirement. So there will be slight change in the basal metabolic rate or resting metabolic rate. So that will not give you exact 3 kilogram reduction in weight, but it will be nearby to that 3 kilogram. Remember, I personally feel that there is no shortcut to reduce the weight. Okay, uh, the scientific formula is the only one, that you reduce your some calorie input and you increase some calorie expenditure. Ultimately that is the only way to reduce the weight, or ultimately to reduce the body fat. So that was the main concept which I wanted to share with you regarding the calorie expenditure. I hope it is clear from my side. Next, principle of overload. I won't take much time for these three principles, as you must be aware about these three principles. Okay, the first one is the overload principle. It says that the body will become stronger and function better if increased demand are placed on it. So whenever you want to train a person, the important component is that overload. Then only training effect will be achieved. If there is no overload, it means there will not be any training effect. If person is able to run 30 minutes, person is able to work for 30 minutes, you should increase the intensity, or maybe you can increase the duration also. But overload must be there to get the training effect. Same way, the second principle is the principle of specificity. Now, here you can say that this person is surprised that how come his cardiovascular fitness is poor, but he must have very strong muscle. His strength is very good, but cardiovascular endurance may be poor because he has trained himself for the strengthening only. he has not done any activity which is improving the endurance kind of activity or endurance. That's why his cardiovascular endurance might be poor. The reason, whichever activity you do, you will get the training effect of that activity only. There will not be much crossover effect. If you train yourself for the strengthening, you will get the strengthening effect. If you train yourself for the endurance kind of activity, you will be having more training effect of that activity only. It will never happen that you have improved your strength and at the same time your endurance is also improved a lot. No, it won't happen. Whatever activity you do, that activity will be giving training effect for that activity only. That is the principle of specificity. Okay, this is now the question that, can you tell me why some sports person continue training after the sports session gets over? And the second question, that do you know that marathon runner may have coronary heart disease? These are the two important questions, and to answer that, we have the third principle.
Excuse me, sir.
Yes, yes, madam.
Sir, your PPT is not changing.
Okay, can you tell me from where it is not changing?
Principles, overload principle.
Can you tell me now which slide is there? I have changed from my PC and now overload principle is there. Can you see the overload principle slide? Excuse me, Mitali madam. I'm not getting any feedback. Excuse me, Dr. Mitali. Dr. Gaurav, can you see my slide?
Yes, it is, sir.
Okay, okay, okay. Which slide is there now?
The body will become stronger and function better if increased demands.
So that overload principle is there. Now just tell me, I'm changing my slide. Is it changing from your side?
Yes.
Okay,
It is changing, sir. Yeah.
Okay. Thank you, and sorry for this interruption.
No.
So we have discussed the overload principle, and the second one is specificity principle. And then these are the two questions which I just asked, but I will only answer for that. Why sports person continue training after the sports session gets over, and the second one, why some marathon runner may have coronary heart disease. We will be surprised that marathon runners who does 42 kilometers of running, they may have also coronary heart disease in future. For these two questions, the answer lies in the third principle, that is the reversibility principle. With the picture, you can clearly say that once you stop doing one activity, maybe after 2 or 3 weeks, again your training effect will be declined. So from figure 1, person can go into figure 2, and if person or that client is not doing any exercise, person is stopped doing all kind of activity, then from 2, person can also come into the first one. That is known as a reversibility principle. That's the reason that we have to continue doing exercise to maintain our fitness. It is not like that if we do exercise for 3 months and after that if we stop doing exercise, we will have same kind of fitness. No, the fitness level will also be getting reduced. It will be depleted. All the training effect which you have achieved after 3 months, it will be declined after 1 or 2 weeks, and again within 6 weeks it will come to the baseline. That is the reason that the sports person continue to do the same kind of activity when the sports session is over, because after some sports session they may have 1 or 2 months gap. So if they don't do this kind of activity or training, after 2 months the training effect will be reduced to nearly zero. That's why they have to do this kind of activity. And the next point, that is the marathon runners, again same principle. Okay, when they have trained themselves for marathon running, they are trained, and once they stop doing activity, again after a month the training effect will be declined. That's why we have to do exercise continuously, and then only we can maintain our fitness. So this is what we have discussed about reversibility principle. Okay, now we will coming to the next part, that is the fit principle of exercise. Okay, it is very easy to understand. Two important aspects are there in FITT principles, which I would be focusing. The first one, that is frequency. How many times in a week exercise should be performed? Research says that if you do exercise from in a week 3 times to 5 times or 6 times, the person will get training effect. It means if you do activity just twice in a week, you will not have any training effect, because that is not sufficient to stimulate our metabolic process. That's why if we do 3 times, that will also give some training effect. If you do 5 times in a week, that would be better. But never do exercise every day. You have to give 1 day rest in between to prevent or to give some time for the healing, which might have happened because of the training, some micro trauma, and this kind of trauma can be healed when we provide 1 day rest. So the simple concept, we can do 3 times exercise to 5 times, or if you are very fond of doing exercise, you can do for 6 times also. Okay, of course it depends, it directly correlating with the effect of training. If you do 3 times, effect will be there, but it will be slightly less than the 5 times of exercise in a week. So the take home message is, at least you do 3 times in a week. If you have time and if you are fond of, you can do 5 or 6 times also. This is very important point, that when someone asks that how hard I should do the exercise, so we physiotherapists consider as an intensity, that what should be the intensity. Whenever the intensity word comes, we know that immediately we will decide the intensity by MHR. Okay, we know that what is the MHR. MHR means maximum heart rate, which we can achieve by the exercise tolerance test. And once we achieve this maximum heart rate, some percentage of maximum heart rate can be utilized to decide the intensity, or we can decide the intensity by the Karvanen's formula. So Karvanen's formula is nothing but the resting heart rate plus some percentage of reserve heart rate. So by these two methods, we can decide the intensity. It means how hard a person should do the exercise. That is what generally we do. We prescribe that you should do the exercise with 60 to 70% of MHR, or you should do the exercise with the 70 to 80% of MHR. But the problem lies here that we don't have that kind of equipments, or we don't find MHR. We generally do by 220 minus age. That also suppose you found by 220 minus age, as it is clearly mentioned, it is not that much accurate. For the accurate MHR, person has to do that exercise tolerance test, and then only real MHR can be found. If there is no cardiovascular or pulmonary pathology, at some extent 220 minus age can help you to find the MHR. But again, suppose you have found the MHR of a 20-year-old person, so his MHR would be 200. We know that with the formula, without doing any exercise, with formula we could find out that that person's MHR is 200. Now we know that we can give exercise intensity with 60%, or we can give exercise intensity with 70%, or we can give exercise intensity with the 80%. Suppose you want to give the exercise intensity of 70% of MHR. So that will be 140. Now how to monitor that now that person is doing exercise with 140 heart rate? It is really difficult and practically very complicated that everybody will buy a wristband, and they will check that my heart rate is nearly 140 and now I am doing the exercise with 70% of MHR. So that is really difficult, and for common person it would be almost impossible to do to buy a wristband and to check it and then perform the exercise. For that, I would like to give you this one, that sometimes we don't use this PRE, but remember this perceived rate of exertion is a direct it is giving direct correlation between the perception of a person and estimation of MHR. It is not 100% accurate, but it is very close to it. It means now we don't know that without finding or without getting any wristband, without doing any exercise tolerance test, if we ask a person to do some exercise, and when person says that I am feeling light, this exercise is light for me, so you can say that the score would be between 4 to 6, or the estimated percentage of MHR would be nearly 70%. If person is telling you that the exercise is somewhat hard, so immediately it is correlating with the 80% of MHR. It means what? First we have discussed that frequency. In FITT principle, first we have discussed the frequency. We have discussed 3 to 5 or maybe 6. Second one, intensity. Now intensity can be decided by the MHR, but as I told you that some difficulties are there. So we can utilize this PRE very well, and with the help of simple perception of patient or person, we can correlate with this MHR. So with this, you can find out the intensity also, that how much intensity you are prescribing or patient is feeling. If patient is or person is telling that it is hard, you consider it is beyond 80. If it is very hard, you consider it is nearly 90% of MHR. Excellent research is also being done that whether this and this is matching. So in most of the person, it is highly matching. So whenever you do exercise, or when any person is doing exercise and person is telling that I am feeling it extremely hard, then you understand that the percentage of MHR will be nearly 90 or between 90 to 95. So this is very important. Simply you ask your client or your person that you do the exercise when you feel somewhat hard. So when patient is or person is feeling somewhat hard, it will be between 70 to 80%. By this way, we can decide the intensity also without getting any instrument, and scientifically proven method. We can prescribe the intensity also. Now, next point is the how much time anyone should do the exercise. Okay, and why? We have discussed the frequency, we have decided the intensity also, and now next one is the time. So American Heart Association and many researchers, they said that in a week, at least 150 minutes of moderate level intensity exercise. 150 minute. Okay, so you can consider 5 times in a week, 30 minutes every time. So 30 multiplied by 5, that is 150 minutes. In a week, at least you should do 150 minutes of exercise to be in a fit level. If you do more than that, definitely it would be better. And it depends on your desire also. If you want to take part in some competition, then definitely your time or duration of the exercise should be little bit more. It may be 180 or maybe 1 hour per day and 5 times in a week. So it depends upon desire or the activity in which you are going to take part. But as a general rule, if you want to be in a fit category, at least you do 150 minutes of exercise in a week. Okay, and you can divide in some equal amount. So simple 30 or 30 to 40 minutes in a day, 5 times in a week, moderate intensity, that is somewhat hard. By the help of PRE, we can give the exercise prescription. See, the thing is that without any equipment also, and with the scientifically proven method, you can just wanted to tell you that he has trained himself in such a manner that his resting heart rate is reached to nearly 33. You just imagine your resting heart rate and his resting heart rate. Of course, he is a very popular athlete, but see, our body can be trained to such an extent also that his requirement of blood is provided by just 33 beats in a minute. And if we consider ourselves, it may be 70 heartbeats or maybe 80 or sometimes maybe 90 or beyond that. Okay, so he has trained himself at extreme level. And if you see the person, he is the Indurain who take part in the Tour de France. Now, Tour de France is the which happens to be in France, where like 3,500 kilometer race will be there, and he is the champion consecutively for 5 times. You know, his heart rate nearly 30. So you just see how much he must have trained himself to reach at this extreme level. Okay, so I shared this slide just to convey a simple message that yes, we can train ourselves. I'm not telling to reach at 30, but yes, by training we can improve our fitness level, and that's why the fitness activity is mandatory nowadays. Last point which I wanted to mention, that is the type of exercise in the fit principle. The last one is the type of exercise. So you can see that sometimes many patient will be asking like walking is better, running is better, swimming, cycling, jogging, or treadmill running, which is better? So every activity which I have shared on screen is better. It depends upon the interest of a client or person or patient, which activity he wants to prefer. If he has some knee pain and he has some difficulty while walking or while doing jogging, he can use swimming or cycling. Okay, if he doesn't want to go out, then he can use treadmill also. And if he's wanted to go out and he wants to roam here and there, he can use cycling. But all activities, all mode of exercise, or all these kind of activities are really better. Any person, any patient can choose anyone from this. Okay, it is equally important. Nowhere it is mentioned that this is far better and this is not better compared to this. All are equal. So this is what I wanted to share with you. If you have any questions, then I would be happy to answer that. because I'm very much interested in calorie expenditure and the exercise prescription, or to find the level of fitness. So, if is there any question, I would be happy to answer that, Dr. Gaurav.
Uh, as of now, we don't have any questions as a audience, have joined to the Facebook Live. But
Okay.
whenever the question will be raised by the students, we'll definitely contact you and will
Okay, sure.
provide a proper answer to each and every students.
I have spent 10 minutes just for question and answer. I was not aware that students would not be joining in this meeting.
They are not a part of the live interaction.
Okay. Okay, fine, fine. Understood. Okay, no issue.
Thank you,
So,
Dr. Jay sir, for
thank you.
sharing your precious knowledge with us. We will be always curious to gain more and more knowledge from you in further time.
Thank you.
I
Thank
am
you.
sure that all of you learned
Yes,
so
and
many new things.
Thank you, madam. Thank you very much.
just
At last,
this is about a participate. Sorry, certificate for appreciation for you, sir. Just kindly
Okay.
accept it. We are sending you online.
Okay. Thank you. Thank you, Dr.
Thank you.
Gaurav.
Yes.
Okay.
thank you
Thank
so
you
much,
for
sir.
giving me in this opportunity. And I hope that my lecture would be interesting for all the participants. And I would request to you that if you get any kind of feedback, please share me. I will take it as a positive way.
Sure. Thank you, sir.
Okay. Okay.
Thank you
Thank
so much.
you.
Yeah.
So, shall I conclude this meeting?
Yeah, sir. It is.
Okay.
Yeah.
Okay. Thank you very much. Thank you.
Thank you.